that we're going to see much greater integration of all the different data silos in primary care, secondary care and social care. Once these interlink, we'll be able to leverage some of the real revolutions in artificial intelligence and machine learning to make some really important inferences about population health and specifically bring it down towards the patient.
We're going to change the way we interact with doctors. For example, your first point of contact may not be a real-life human being. It might be a chatbot or an algorithm trying to work out the diagnosis initially. That will help us enormously manage the efficiency of a health service. The second one, I think, is robotics. Robotics and automation, about how we're going to change surgical practice and how we look at things a different way to make our lives slightly easier.
The next thing that I would suggest is going to be very dominant in robotic surgery is to have integrated systems. So we'll see good quality imaging in 3D, high quality, integrated with a planning system and a simulation system, so that before you start, you can go through the whole procedure and there's absolutely no surprises on the day.
In my area of medicine, which is respiratory medicine, patients will be able to have devices which they can use themselves to monitor their lung function at home, and in doing so they'll take ownership of their own health more than they do so at the moment.
There will be iterations in treatments, drugs, which will allow us to treat cancer in perhaps a more informed way. At the present time, a lot of cancers tend to be treated in a one-size-fits-all scenario. But we know cancers don't behave that way, and I think with an increase in our basic understanding of those, we'll be able to find out why there are differences and tailor treatments more to an individual patient.
I know everybody talks about big data, but we've now got low-cost sensors that we can fit into the things that we wear. I mean, things like earbuds, headsets. We're not going to need anything special to be able to find out all sorts of things about our daily life, whether that's blood pressure, pulse oximetry, heart rate. And with that data, we can start to pool information on just how we are, whether we're healthy, whether we're unhealthy, that whole spectrum, and start to use that to look at better outcomes.